Hi, I'm Lily Peterson.
And I'm Paul Wilson. Welcome to Beyond Benefits with Benefits Pro. In this episode, we talk to Deb Ault, better known as Nurse Deb, the president of AIMM. We discuss her dedication to change, both as a nurse and as a pioneer of disruption in the healthcare and benefits space. We also chat about the challenges of employers and employees and their slow acceptance of change, as well as the realities of working in a broken healthcare system. One of the biggest challenges Nurse Deb shares is that many employers are just not yet upset enough with the status quo to demand something different. In her words, until people are pissed off, they're not going to change. But don't worry, as always, we also get to know Nurse Deb on a more personal level. So we spend some time chatting about how she spends her free time, her most recent vacation, and also some secret treasures in Columbus, Ohio. But before we jump into that, first, as always, let's take a couple minutes to catch up. How you doing, Lily?
Good. It's been busy work-wise and outside of work. So just chugging along. How are you?
Same. Yeah. I feel like in my mind, the fall is always this quieter time, and all of our benefits folks out there are laughing because it's like
Yeah.
never their quiet time. But we're feeling their pain this year because I feel like we're in a similar boat where there's a lot of stuff happening in our business world, but also, yeah, in our personal lives. But a lot of that personal life stuff has been pretty good. I know that we've both been busy on the weekends, but doing lots of fun stuff. I can jump in and just mention we were going to talk a little bit. We always mention all the, kind of the secret spots and ask our listeners to kind of share some of the hidden treasures in their areas. And I know we've talked about Colorado and Denver a fair amount over the course of this podcast with guests and with each other, but I thought it would be kind of fun if we just maybe do the same thing that we usually do and share some secret gems around Colorado and Denver. And I'll kick it off by mentioning I was up in Grand Lake over the last weekend for kind of a long weekend. And I don't know how much of a hidden gem that is, but Rocky Mountain National Park is a beautiful place. Probably many of our listeners are at least aware of it, and hopefully some of them have visited. It's just absolutely gorgeous. So much wildlife and just natural beauty. And a lot of people from the Front Range come to it through Estes Park, which is very, very busy. It's a nice touristy place, but it's
Yeah.
kind of a zoo at times. Grand Lake is on the other side of Rocky Mountain National Park, and I feel like it's everything that Estes Park was when I was younger, like maybe 30, 40 years ago. It's a nice, quiet-ish. It's still touristy, but
Yeah.
it's just such a beautiful little place. Yeah. And so anyway, we spent some time there, had a nice little cabin and just had some, puzzles and wine. And it was a nice misty, rainy weekend. But it was just like, it reminded me of, it's so easy to get into travel mode where you're thinking airplanes, but so often in your own backyard, there are these areas where, you don't take enough advantage of them. So that
Yeah.
is a somewhat hidden gem, Grand Lake in general, that I think maybe a lot of people might not know about.
Yeah. I've never been, but
Mm.
your weekend sounds perfect. I'm a little
Oh,
jealous.
yeah, it was much needed. Very amazing.
Yeah.
We were hoping to see, because there's a lot of, like signs for like moose and
Yeah.
bear. We unfortunately did not see any moose or bear, but we saw a lot of deer and a lot of elk right along the
Oh,
side of the road. There were some elk. I'll send you some pictures, but also
yeah.
there was a really cool thing. It was a really foggy, misty day, and we pulled over to the side of the road and looked out, and there was a whole herd of elk that were out in this
Oh, that's
meadow, and then
cool.
behind them was like the mountains and the mist, and they were all bugling.
Oh,
And I'd
that's
never
cool.
heard that, the bugling of the elk, and it was just very,
I've
very
only heard
surreal.
it from like an elk call,
Mm.
like a
Hmm.
hunting thing.
Yep.
I've never heard the actual.
Oh, yeah. It was amazing. Very cool. Yeah.
Yeah.
But so those are a couple off the top of my head, but I know that you are always going someplace cool. You probably have like the young person's hip version of this. Like,
Yeah. Yeah. I feel like I am always out to dinner, always going to grab a drink. It's, I think, what people call a hobby, I
there
would
you
go
go.
as far as saying.
Yeah.
But I'll throw out a couple places. My favorite Italian restaurant in Denver is called Odyssey, and it's
Mm.
on, I think, 6th Street, but it is like just in this old house. They converted this huge old house into a restaurant. And, if you sit upstairs, you have to walk through the kitchen to get up there. It's so cool. And then on Mondays, they do half price pasta dishes, and it
Ooh.
comes with like a Caesar salad and bread and all of that, but you still get the huge dish
Mm.
with that. So
Amazing.
that's so good.
That's a good way to make Mondays a little better, I would say.
Oh my God, yeah. But then you have, something to look forward on a Monday. So then on Tuesday, you're still a little sad.
That's true. You're just putting it off a little.
Yeah, exactly. And then I think like beer and breweries is a Colorado staple.
Yeah. Absolutely.
You know, I'm from the Midwest, so I feel like they all drink a lot, but I feel like there's something about like an IPA in Denver that people just go crazy for. So the Denver Beer Company is so good.
Mm-hmm.
And there's a couple places in Denver. I think there's like 3 locations, 4 locations,
Yeah, I think so.
but one of them is in Littleton, which I've gone to with you, Paul.
Mm-hmm.
And downtown Littleton is also so cute because it's like an old school downtown kind of thing. But then one of our coworkers and friends has a bookstore down there.
Mm-hmm. Yeah, Spell Books is right down there. Like you said, downtown Littleton, it just feels like an old school, not quite Mayberry, but like that feeling of like a little street with all kinds of cool shops. Yeah,
Yeah.
Denver Beer Company is amazing. And yeah, Spell Books, where our friend Corey has her bookstore, is such an amazing little place down there. It's just one of so many cool places. There's another place called Playforge that has all kinds of like board games and, you know, D&D and that kind of stuff. There's cute coffee shops. Yeah, I
Yeah.
completely agree. I'm so glad you mentioned downtown Littleton because I do think that it's a very much a hidden gem that
Yeah.
may not get as much notoriety as something like the 16th Street Mall in downtown Denver. But if anybody's ever in the area, I would highly recommend heading down there. There's all kinds of great food, drinks, lots of fun shopping. Good
Yeah.
call.
I agree.
Yeah. And one more that I'll throw out there. I don't know how hidden it is, and I think we've actually mentioned it before, but Cherry Cricket is a
Oh, yeah.
well-known
Cherry Cricket's
burger
so good.
place, yeah, here in Denver. So if anybody's ever around, that's a great place to just go. I mean, they used to have, I don't know if they still do, but they had a dartboard where you could just, it had all the toppings on there and you would just throw darts
Oh,
if you
that's
wanted to get
cool.
adventurous. So you could get like a peanut butter bacon jalapeno burger or whatever. But yeah, if anybody's looking, it's a little divey, but in a good way. Still lots of
Yeah.
families and stuff, but the floors might be a little sticky, but it's worth it. Really good stuff. So
Yeah.
no, those are good. I mean, we could go on and on. If
Yeah.
anybody
I was
has
going to
questions,
say,
if you're going to be in Denver, reach out. We're happy to recommend lots more places, but we should probably get on to the main episode.
yes.
Yeah, again, so we're so excited that we got Nurse Deb to join us. And so let's go ahead and dive right in.
Joining us today is Deb Ault, better known as Nurse Deb, president of AIMM. Welcome to Beyond Benefits, Nurse Deb.
Thanks for having me.
Yeah, we're so happy to have you on. I don't know what took us so long, but we're glad to have you here. How are things going in your world as we enter Q4 craziness?
Doubly crazy in Q4. I don't think we've had a down period all year, so it's getting a little hairy.
Yeah, I can only imagine because, like you said, I know even at the best of times, it's not like you have your feet kicked up on the desk. They keep you hopping.
Right.
Yeah. Well, I think, most people listening to this probably already know who you are, but we don't want to make too many assumptions. So to kick things off, can you just introduce yourself, give a little bit of a background about yourself and kind of how you got into the benefit side of the industry?
Yeah, absolutely. Well, my name is Deb Ault. I'm a registered nurse. I'm the president and founder of AIMM. That just means I have the distinct pleasure of leading a team of nurses and doctors that come alongside patients primarily telephonically, although there is a lot of tech, except, the people that are actually generating claims are not usually those that are tech age. They're more 40 plus. But anyway, we come alongside them and we handhold them through the two most cumbersome ecosystems in the universe. The healthcare delivery system. So what care should I be getting? When should I be getting it? Where should I be going to get it? What is the best care? Who are the best providers of that care? And the health plan system. Oh my golly, how do I avoid bankrupting my family and my employer as I'm going through this health event? So we get the fun of marrying together that clinical and financial and helping people navigate those two systems.
Awesome. Yeah, as we said, never a dull moment for you. You touched on it a little bit, but like, what does a day-to-day in the life of Nurse Deb look like? I can only imagine that no 2 days are exactly alike. What do you do? Like, head on into the office and then what?
Once I brush my teeth, right?
Right. Exactly.
Yeah, I mean, every patient is different. And I think that's one of the unique things about working in healthcare. You can know all the science, you can know all of the math, but each patient has their own unique situations, circumstances. So whether it's a social determinants of health issue, it's a socioeconomic issue, it's a religious issue, it's a organic capability to understand, right? I mean, chemo brain is a real thing. So dealing with patients every day, all day long is very exciting and interesting in and of itself. So no 2 days look alike in our world. And I kind of joke around and say I'm going to change my LinkedIn profile title to professional healthcare whack-a-mole player. Not only are no two patients the same, but about the time we think we get a problem solved in the US healthcare system, they come up with some other interesting, new, creative way to make us have to go hunt for another solution. So
Yeah.
it's always a challenge.
Yeah, as Paul mentioned earlier, we're heading into Q4 craziness and open enrollment season. So I know it's your day-to-day already sounds a little crazy, but what does specifically this season look like in your world, especially as you're working with benefit advisors and employers?
Most of the advisors that we work with are pretty advanced. They're part of Next Gen, they're part of Health Rosetta, they're kind of part of the disruptor movement. So most of them have put to bed all of their renewals, in the last at least 30, 60, 90 days. Most of them are not waiting until 10/1, 11/1 to be addressing 1/1 renewals. So most of the stuff that we're working on these days is new business that's kind of coming in. And as we're moving up market, we have a lot of groups that we've been talking for the last 2 or 3 months about January 1 of 27, right? So it's kind of a never ending cavalcade in our world. To us, a patient is a patient is a patient, although we do see a little bit of a spike this time of year for people that are kind of still of that traditional mindset, like, oh, I met my deductible, so I better get these last handful of things done before that resets next year. If somebody's on a guided plan, one of those where they call the nurse first and they follow the nurse's guidance and advice, their care becomes free with waived deductibles and copays. If they're on that kind of a plan, you run into a little less of that because they haven't met their deductible. They've been getting, guided care all year long. So some of that phenomenon still happens, but not as much as what we've seen in years past with status quo type plans.
Yeah. No, that makes a lot of sense. Well, speaking of those status quo plans, I mean, like you said, I know that you guys typically work a lot more with a lot of the next gen and some of the more innovative and advanced advisors, but it's been a process, I'm sure, even for them to get to this point. So open enrollment, but also just year round, what are some of the biggest mistakes and misconceptions that you have seen? What sets these advisors who are doing it, quote unquote, right versus those who are maybe still struggling? What are some of the mistakes? What are some of the misconceptions? And then what are some of the things that you're seeing them do differently that makes a huge difference?
Well, I think a lot of those mistakes and misconceptions start all the way back at the prospecting stage. So I had a conversation this morning. Actually, I've had 2 of them in just this 24-hour period where I'm like, you need to just disqualify this lead. Some people are not really ready for guided plans, and that's okay. We can meet them where they're at, right? We have very traditional models available. It may not be what everybody knows us for, right? Everybody knows the guided plans, but sometimes groups just really are not ready to go there. And I think lots of times, especially a newer broker will get excited, and I know it's best for everybody. What you have to know is it's best for everybody when they're ready to go there. Trying to put that square peg into a round hole is bad all the way around. So getting to the point that you're comfortable saying, whoa, 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 I know we talked about guided plans. We believe guided plans are the best thing since sliced bread, but maybe we need to pump the brakes here and look at a guided plan next year and do something a little more traditional this year. And being comfortable saying that as a consultant or advisor, and being comfortable disqualifying them and saying, you're not ready for this, because there are groups that are not ready for this. One of my Debisms is if I've answered the question 3 times, one of 2 things is happening. Well, maybe one of 3. I'm not communicating clearly, so you're not understanding, right? So that's one. The more likely is most of the people we work with are not dim-witted. If we've answered the question 3 times and they're coming back a 4th, they just don't like the answer. So recognize that and use that as a disqualifier to say, maybe you're not ready for where I'm trying to push you to go, because it feels like maybe you're not liking the answer on that, right? And that's hard when you're a producer and you're out trying to get as many customers and when you're passionate about this and when you know guided care is the way to go, but getting comfortable to disqualify those prospects. And then when you do put these kinds of plans in place and you're going into open enrollment, it should not be more than a 10-minute meeting and you should not talk about more than one thing. I think we go in and we have these hour-long open enrollment meetings and we talk about major medical and life and disability and vision and dental, and we talk about 8,000 things in that meeting, and the patient walks away not understanding any of it, right? So if we can just keep it super simple, chunk it down, that is much more absorbable for a patient. Especially on guided plans, we say call the nurse. Oh, that's all they need to know. Any health problem, call the nurse. Any insurance problem, call the nurse. Just call the nurse. Just call the nurse. Just call the nurse. Because as you get into these unbundled or rebundled or non-traditional plans where you've got a TPA and you've got a PBM and you've got a network or you've got an RBP or it gets really confusing really fast for the typical patient. So you've got to super duper simplify it for them.
Yeah.
And then the third failing that I see is people who want to go out and sell it and drop it and walk away from it and not go back until renewal time. These plans do not work well in that environment. They need ongoing TLC. So whether that's the broker or the consultant or the advisor or their account management team or whomever that is, they need ongoing love and attention and communication, especially that first year for about 6 to 9 months.
So you've come to be known as this advocate and face of a lot of ideas and strategies that are outside of the status quo, which often are referred to as, these next gen practices. Can you tell us how you became familiar with these ideas and eventually decided to help champion them?
Oh, that's a very good question. I think most nurses are intrinsically programmed to be patient advocates. That's what we all grew up wanting to do when we became nurses, right? We were trained as nurses that we are the last line of defense for our patients and to look at patients holistically and to provide education and resources and support and guidance, but to honor free will and autonomy. So I think that's just how nurses are trained. I think the only thing different about it, really, from my perspective, I certainly stand on the shoulders of greats like Anne Llewellyn, the founder of patient advocacy in the United States, Catherine Mullihay, who really formalized the first patient advocate case management models long before I ever came onto the scene. So I think it's just learning from folks like that. The only thing that I've really done differently is to tap into the broker market or the consultant advisor market. And when I ran into challenges doing that with kind of the big houses, the alphabet soup houses, as I call them, being willing to work with the independent brokers, advisors, consultants, and bring education and resources and support to them. I've always kind of approached this as a patient is a patient is a patient. I don't care if a group has 2 employees or 2,000 or 25,000 employee lives. To us, a patient is a patient. So we've always kind of been agnostic in that regard. The other thing that I probably did that is a little different is get really ticked off really early and decide somebody's got to do something. So why not me? And be willing to jump in with both feet and say, this is right, that is not. I'm going to do what's right. I'm not going to do what's wrong, and be pretty vehement about that. Not a lot of people, I think, have just said, no, this is right. That's wrong. I'm going to do what's right. And often, regardless of the consequences personally or financially.
Yeah. No, that's a great point. And it's one of, I think, your superpowers is you are a very nurturing, caring person. You are a nurse, but you have that ability when necessary to turn on that, as you put it, anger, or to push hard where it needs to be pushed. And I think that has served you well. And it's probably, honestly, one of the things that is going to be required in order to turn around this big behemoth of a healthcare system and start to do things right.
Yeah, Drill Sergeant Deb is an actual thing. And I don't love it when I have to pull that out, but often it becomes necessary. I mean, there's so much happening to patients in today's health and insurance systems that is just not right. Somebody has to stand up and put their foot down and go, I'm just not going to stand for it. I'm not going to allow it. I'm going to figure out the way to fix it. And I'm not going to rest until I do.
Yeah, absolutely. Well, I mean, you touched on the innovative ideas, and we've talked about that a little bit. You mentioned in particular a lot of the independent advisors who are really championing these ideas. But even within that space, and especially outside of it, a lot of these ideas are relatively new and unknown for so many people, even though they have now been circulating for years. But since you've been there, quite a while in this space, how have you seen the views of benefits advisors, employers, and others within the industry change over the years when it comes to these ideas? Where do things stand now versus where they were when you first started hearing about them and talking about them?
Well, I mean, it's healthcare, so things change every single day, right? It's also business, so things change every single day.
Right.
The only constant really is change. I don't know, Paul. I mean, the US healthcare crisis, if you really trace it back, it started in 1960, which, despite my gray hair, is before I was born, right? So
Right.
that is not new. It's been brewing for a long time. I think we have finally seen employees, patients that are completely fed up, but that in and of itself isn't even new. I mean, Dave Chase wrote about the NPS scores of insurance companies, and the only thing people hate worse are cable companies. And, we saw they already cut the cable on them. So
Right.
the only constant really is change.
Mhm.
And I will tell you, like in the beginning, a lot of us thought it was about the money, right? Oh, we'll stop having a benefits conversation with HR and we'll go talk to the CFO. But I actually just did a strategy session this morning with 4 very innovative independent advisors from across the country, all of whom have been doing this for more than a minute. Every single one of them said they still run into problems getting the CFO to get engaged in the conversation. So while the cost is unsustainable for the 64% of Americans that are skipping healthcare because they're afraid of the cost, we haven't seen the same become pervasive in the C-suites at the employer level.
Mhm.
And so to me, that's probably the biggest challenge. So we stopped trying to have as much of a financial conversation because we figured out that the CFOs are projecting an 8% increase and they're budgeting for it. And, as long as it comes in at or below that, they're not going to be willing to get very creative.
Wow.
And starting to kind of get them to understand, because most of the C-suite is somewhat disconnected from the typical employee in terms of pay scale. So a $5,000 deductible to somebody who's only bringing home $40,000 a year is very different than a $5,000 deductible to somebody who's bringing home $100,000 a year or $250,000 a year, right? So
Mm-hmm.
getting better at the conversation when we have to use math to put it in mathematical terms that the C-suite can relate to is probably where we're at right now. But I think we've also recognized within the movement that it's all about the patient at the end of the day. And I think for me personally, the presentation that led to the book Life and Death Decisions in the C-Suite was kind of a sentinel moment. It was where I had gotten so frustrated and so upset that people just don't seem to be recognizing that these are the lives of other human beings that we're talking about, that we're impacting, that, we're spending money on, and losing sight of that patient was just so frustrating that whole presentation and then book and so forth came about.
Yeah, no, that's a great answer. I mean, you talked about how there's still so many challenges, but anecdotally, I spend a lot of time at conferences and talking to advisors. To me, it seems like there has been quite a bit more acceptance within the spaces that we work in with, the independent advisors in particular. even over the last 5 or 10 years. Do you feel like within the advisor community, there is a growing acceptance and excitement about a lot of these ideas despite these ongoing challenges?
Oh, heck yes. I mean, 15, 20 years ago, we had 8 customers. Now we have hundreds and hundreds and hundreds of customers. If you attended Ascend this year or you attended Health Rosetta this year and you saw the number of people in the room and the number of new faces in the room, absolutely you see that, that tide is definitely shifting in the advisor consultant market. Now, can we take that upstream into the employers? Can those guys carry the message into the employer level? Gosh, I sure hope so, because the level of desperation on the patient side is at a fevered pitch.
Yeah, absolutely. I agree.
Can you touch a little bit on, how you think advisors help move them in the right direction without scaring them off or moving too quickly?
I'm glad you asked that question that way. There is this thing called the Beck-Hard-Harris change model, and it looks at when will people change. We also study that under Prochaska method. We also understand it through motivational interviewing, Carnegie techniques. The truth of the matter is, and forgive me for, I'm trying really hard to stop cussing, and then you ask me a really good question. Until people are truly pissed off, they're not going to change. And so I think the employers in the United States haven't gotten there yet. They're not ticked off with the status quo, the traditional. Some are, and some are seeking it for financial reasons, and some are seeking it for people reasons. But we haven't really yet hit that tipping point where they're so ticked off that they're willing to say, that's it, enough. They're not demanding the innovative solutions from their giant consulting houses. And I think until that happens, we'll still be kind of swimming against the current, to some degree. But I think people have to become so dissatisfied with how things are today that they're willing to consider a change. And so I hope, because here's the other challenge, I think traditionally speaking, brokers, advisors, consultants, and Paul, I said this on the stage at the conference where you were interviewing me. If you all want nice, call Dan Thompson. He's the nicest guy on the planet. Don't call Nurse Deb, right?
Right.
My job is to come along and smack you upside the head with the truth that these are life and death decisions you're making. Most advisors, consultants, because they have for so many years lived off of the relationship, and tend to be they want 100% of the people to be happy 100% of the time. And that just doesn't happen with anything that's revolutionary, right? Some people want the status quo and want to stay in that. And you have to be okay recognizing that they're the small percentage. So it definitely has its challenges, but I think the broker advisor community has to figure out how are they comfortable getting their customers, their employers, so dissatisfied with the traditional status quo that they're able and willing to make a change for the better.
Yeah, no, that's a great answer. I mean, I'll help you here. If we're trying to piss people off, I know that one of the things I've heard you talk about a lot is this myth that America, as is, has the greatest healthcare system in the world. And I've heard you give some very compelling evidence to the contrary. Can you do a little bit? I mean, I know that's a big question, but can you dig into that a little bit and explain maybe why that is a misconception and how it can be turned around, at least to some degree, by some of these ideas?
Oh my gosh, there are so many examples of that. I mean, look at the lifespan of a typical American. Look at our infant mortality rates and our maternity complication rates. Look at the leading causes of death in the United States. Look at the cost of care in the United States compared to other countries. When you put cost and quality on a chart for the US and compare it to other countries, it's really clear really quickly that we are not all that in a bag of chips. Now, that's not to say that we don't have some of the best practitioners in the world. We do. Not to say that we don't have some of the best researchers in the world. We do. But overall, when you look at the outcomes of healthcare in the United States and you look at the cost of healthcare in the United States, things are completely out of whack.
Yep, absolutely. I mean, again, I know that we don't have the solutions necessarily because it's a big problem, but I mean, I know Lily's going to ask a question a little more specific in a minute, but can you dig into how you explain to people how broken things are without completely, discouraging them? Like, are there any stories or anecdotes, or how do you kind of turn that into a positive thing where we can create some change?
Yeah, I mean, it depends on who you're talking to, right? Anytime you're having this conversation, first you've got to know your audience. If I'm doing this with an individual patient, I ask them questions. And by the questions we're asking, we're kind of leading them down a path. Did your doctor talk about this type of approach to the surgery? Have you talked to anybody about whether this doctor has good outcomes? Have you done any research into whether this doctor has a good reputation or not? Have you asked this doctor about his infection rate? And then I start to present kind of facts to them, right? When we do a case mix adjusted severity risk indexed scoring of this practitioner, here's what their score shows. Here's what it tells me. If you were my mother, cousin, sister, best friend, I would have these questions or these concerns, or I'd be looking at these key factors. If you're doing it at a group level, again, depends, right? Which one of you sitting around this C-suite table is going to fess up that you're in the middle of, or you have a family member in the middle of a health issue? Has anybody from your insurance company called them and offered to help them? Are you okay with that? Right? So, because the answer inevitably is no. My wife has breast cancer and nobody has called and offered her any kind of help, not from the insurance. So it depends on who you're talking to. But I think most Americans know somebody who's gone bankrupt because of healthcare cost, or they've been asked to contribute to a GoFundMe to help somebody with healthcare costs. Most people know somebody who got poor outcomes, had a horrible healthcare experience, had a recovery that didn't go well. But in the documentary, one of the clips that I often share with people is one thing the US healthcare system is really, really good at is convincing individual patients that they are the most unlucky person on the planet. And in reality, when you find those people who had bad experiences and bad outcomes, and you go back and anecdotally look at the objective quality scores of the practitioners and the facilities that they utilized, you go, well, we should have been able to see that one coming. If only we would have looked at those scores before they had that procedure or service, we would have waved them off. So there's a lot of finger pointing that happens in healthcare and health insurance and benefits and all of that. Somebody has to come alongside the individual patient and stand staunchly with them and equip them. Because the other problem is there's no single consumer reports of healthcare. It's not easy to go Google who's the best doctor for this particular thing and get good, credible information. So there are just so many challenges that when you lose focus about who you're actually here to serve, right? When the employer does not view offering their health benefits as a necessary component to care for and steward and shepherd the lifeblood of their organization into optimal health so that they can be a present and productive employee. If the employer doesn't recognize that, if the advisor consultant doesn't see that you don't have a customer if they go bankrupt or lose all of their employees to bad healthcare or lose their key employees to healthcare, everybody in the equation needs to be focused on the patient, except everybody in the equation seems to think that somebody else is the whole reason they're doing this.
So I think you've touched on this a little bit, but obviously a big part of the issues that we're talking about and that we're asking you these questions on, they're focused on like the established systems and all of the misaligned incentives and other issues that come with them. how are things changing when it comes to providers and health systems? And kind of, are you seeing more acceptance or still just this constant battle?
We have seen several spikes over the last 10 plus years of practitioners in the marketplace. So, this whole free market kind of concept. The challenge with that is independent imaging, for example. There was a big movement across the US for independent imaging centers to be opened in a number of locations. And it didn't take long before the established hospitals and health systems went out and bought up those independents. And when I was talking with some of the people who invested in creating those independent centers, I said, I don't understand. You did this for a reason. And inevitably, it happens. It happens with imaging. It happens with surgery. It happens with DPC practices. It happens with every hands-on care provider that you can think of. When a giant hospital or health system comes in and offers an outsized number, right, a multiple that nobody in their right mind would offer, it's really hard to justify to your family at the end of the day why you didn't take that check and walk away. And so, as long as hospitals and health systems are capable of doing that, I think we'll continue to face a challenge and a problem. I mean, not everybody in the world can be Dr. Keith Smith, who's doing it for moral reasons. Not everybody in the world can be Nurse Deb, who says, listen, I'm going to survive even if I have to live in a cardboard box to do it. So not everybody is capable of walking away from those giant checks that come along. So it's a real challenge and a real problem, because about the time we feel like, okay, we've got a good nationwide presence for surgery, for infusions, for imaging, for, whatever, somebody will come along and buy them up.
Yeah. I mean, that ties into something I wanted to ask you. So many people I talk to in this industry and in this movement are so optimistic and so excited. And yet, the realities that you just described and some of the other stuff we've touched on, it's rough, it's hard. It's a long-term commitment that doesn't always go well day to day. How do you and the other people you talk to kind of balance the realities of this huge behemoth with all this money and the negatives that brings? How do you kind of remain positive and focused and inspired despite all of that?
It is a challenge. A similar question came up. I was at Nelson Griswold's mastermind not too long ago, and we were talking about mindset, and especially for those of us that have been doing this for a long time. Like, you think you're going to see the overnight break in the dam, and it's all going to break open, and it's going to be great. And then you're 10 years, 15 years, 17 years, 30 years in, and the dam hasn't broken yet. It can get discouraging. And I said, the dragons that we're trying to slay are sometimes so big that it can feel impossible. The way that I and my team and those that come to us in terms of advisors, consultants who've been successful kind of deal with that is to focus on the individual patients, right? When I think of the thousands and thousands and thousands of patients that we've had phenomenal outcomes with, that have had the best care from the best providers, that have saved massive amounts of money, that have avoided going into bankruptcy, those individuals make it a lot easier to get up the next morning and do it all again. And in reality, whenever you go back and you analyze, so I struggled with this just a week ago, where a broker went out doing some renewal meetings, a handful of groups, all of them had at least one person who had the same complaint. Well, then I went back and I analyzed, and I'm like, wait a minute. Okay, we've got less than 10 people out of almost 2,000 people who have this issue. It comes back to the kind of grounding yourself in the reality that because this is so big, you're never going to be able to keep 100% of the people 100% happy 100% of the time. there's going to be somebody who is unhappy, whether rightly or wrongly, because those of us who are innovators and creators are not perfect the very first time we try something, right? And so what level of good enough is good enough for a particular patient, for a particular employer, for a particular advisor? I think that is something that we need to do a better job as an industry establishing in the beginning, so that we have those parameters kind of outlined. And so we can harken back and say, now remember, when we were going through the selection process and we said if 95% of the people are happy, that is a win. And so we've got 97% that are happy, and these other 3% that are not happy, we said when we were going through this that that would be okay. Is it still okay? Right?
Yep.
And we probably haven't done a good enough job of that as an industry. I know I personally feel like I haven't done a good enough job of that.
No, that's really great practical advice. One more from me that's kind of related to that. A lot of the people listening to this are probably benefits advisors or other benefits professionals. Many of them probably are familiar or maybe directly involved in a lot of these really cool, innovative things that the Next Gen movement and others like it are putting forward. But any advice for those who maybe are just starting and they're kind of familiar with this? But I know from talking to a lot of brokers and advisors who first get into the industry, it's not that they don't want to get involved in these movements, but it's a lot. I mean, it is intimidating, complicated. What practical advice would you have for people who are maybe interested in joining this cause but don't really know where or how to start?
Readers are leaders. There are so many good books, articles, blogs, podcasts if you're not into the reading and you want to listen, but I would start there. I mean, I know the Next Gen group has 7 or 8 books out. Dave Chase has a couple out. Chris Deacon has a new book out. I would definitely start there. I would also start with like LinkedIn. If you're not following me on LinkedIn, I invite you to do so. I connect with everybody on LinkedIn. There are others out there. I mentioned some: Dave Chase, Nelson Griswold, Lester Morales, David Contorno. You know, there are just so many good folks out there that are doing it and have been doing it for a long time, and that are more than willing to share anything that they can share that would be helpful to you. Understand, if I were to put a number on it, I would say there are probably still less than 200 benefit advisors across the entire United States who have done even one group that's truly next gen, unbundled, rebundled, self-funded, guided care type plans. So it's definitely a blue ocean for anybody who's willing to put in the work, but go into it knowing you're already a little bit behind the curve. You're going to have to do some pretty intense study. Nelson Griswold has a great boot camp for brand new advisors. It's a 3-day immersion. I would highly, highly recommend doing something like that to get a massive jump start, but you got to start somewhere. And every day that you wait to start is another day you're falling behind. So I would jump in with both feet sooner rather than later.
I love that. And I especially love the fact that you pointed out that despite how it may seem from the outside, there are still a lot of people who are not doing this. Because sometimes when you go on LinkedIn or you go to a conference, it's easy to think that everybody else is already way, way, way ahead of you on this path. But I really like that you pointed out that there are not as many people doing this as it seems like sometimes, and there's plenty of room for those who want to join in. So yeah, that's really good.
Well, there are a lot of people who, quite frankly, are implementing it at the brochure level. They talk about it. They might show it. They might have some LinkedIn posts about it. But when you get right down to it, how many customers do they actually have doing it? The answer very well may be 1 or 0. Because the other thing is, these kinds of plans, when you get into guided care plans, like I mentioned, you can't just sell it and drop it. You got to service it. They are a lot more work. This is not lazy man's fodder here. This is not go out on the golf course and spend the day with your buddies and walk away with 4 or 5 customers and rinse and repeat tomorrow. There are producers who do that, but in order to be successful, they've got to have a lot of backroom support. And that means training the backroom support people too. That's a very common challenge. The agency owner or the principal or the partner or the lead producer will go and get educated and do all this research and start going out and talking about these kinds of plans. But then they don't have their support team and their account managers up to snuff on these kinds of plans. And then they've got to resell it to their own internal people. Right? So take your team with you. If you're just getting started into this, don't try and go it alone. Get involved in something like the Mastermind or the Health Rosetta community, but I wouldn't ignore it. I think people that are going to ignore the solutions to the U.S. healthcare crisis are going to find themselves on the outside before too much longer.
I love that. I think that's great advice, especially for our audience. But we're about to close out this portion of the interview. But before we do so, we like to ask everyone who joins us on the podcast, to finish the sentence. So just in a few words, whatever you're feeling. But the sentence is, the thing that makes me most excited about the future of our industry is...
my grandchildren.
I love that. The future generation.
Yep, that's a great answer.
Okay, now it's time for the second part of our interview, which is all about you. As we've already discussed today, this industry is tumultuous and very demanding and very emotionally intense. How do you relax and refresh?
I pray. I spend time with my family. I walk and I crochet.
Ooh, good combination. I'm a big walker, so I will completely agree with you on. I'm always amazed at how much that can change my mood, change my entire outlook, just getting outside and fresh air, birds, getting some exercise. And then crocheting, that one makes me very happy because my grandma, who passed away a few years ago, she was 96 and she was the queen of crochet. So
it's quite relaxing.
Yeah, it is. Even just to be around, I will say. Well, we also like to ask all of our guests for recommendations, and we open it up to anything that calls to you. I mean, books, movies, TV shows, podcasts, anything else. It can be industry related or it can just be something fun.
Well, I mean, my favorite book, of course, the Bible, but Life and Death Decisions in the C-Suite, if you haven't read it. I know it probably sounds self-promoting, but I would highly recommend it. The documentary, it's not personal, it's just healthcare. If you haven't seen it, would highly recommend you take a peek at it. Dr. Death, the podcast, and the Peacock documentary. There are a couple of other ones out there now as well. So I think if you really want to find stuff, you can. Marshall Allen's book, Never Pay the First Medical Bill, his older blogs, a lot of those are still, he was so far at the forefront that the stuff he wrote is still applicable. So I wouldn't overlook that. But yeah, there's a lot of good resources out there. I think at the end of the day, this becomes a very personal endeavor, right? I think the people that are most successful at it feel called to it and or had personal experiences that led them to a path of, I can't do anything else. I have to do this. Those are the ones that I've seen who've been successful.
Absolutely. Thank you.
And a little birdie told us that you just got back from a really exciting trip. Will you expand on that and tell us a little bit about that?
Yes, I went to Hawaii with my husband. So we crossed it off his bucket list. He's been wanting to go since he was a child. So it was worth the plane ride.
No matter how long it was, right? Did you guys mostly do beach time? Did you hit the restaurants? Did you do any hikes? Like, what did you guys do while you were there?
All of the above. So we flew from here to Chicago and then Chicago over to Honolulu, where we spent most of our time, although we did hop over to the Big Island and do the Volcanoes National Park. Would highly, highly recommend that one, especially if you like walking, hiking. Great place to visit for sure.
Nice. And I've got to ask, because I'm a foodie, what was the best meal you had there?
Oh my gosh, you're not going to believe this. Because, I mean, literally we ate at some of the best restaurants on the planet. But the best meal that we had while we were there was at a mom and pop called Waffles and Berries.
I like the sounds of that one. I'll have to do a little research.
That's all they serve. And the owner was there working. And, it was one of those places where you're like, This feels good, right?
Yeah, I love
No
that.
disrespect to Wolfgang Puck's. His food was what you would expect from Wolfgang Puck, but I love the experience at Waffles and Berries.
I love that. Sometimes the family owned or the greasy spoon is all you need. So that's a great answer. Well, then if we're going to bring it back a little closer to home, we talk to people all over the country, but we always like to just check in and learn a little bit about where they're from. So can you talk a little bit about Columbus, Ohio, and just a few insider secrets? If we're ever in that part of the country, what are some good restaurants or some good, bookstores or whatever the case may be?
Yeah, when you said you were going to ask me about home, I thought you were going to want me to describe the Marriott.
Right. For you may need a refresher on your hometown from time to time.
Oh, Columbus, Ohio is a phenomenal place. It is very entrepreneur friendly and very tech savvy. To be the biggest little cow town in America, we certainly have outgrown that for sure, but very multicultural. So, no matter what you're in the mood for when it comes to food or entertainment, or even a church service, we have every kind of community that you can think of here. And that's one of the things I love the most about Columbus is that we really are a melting pot here. And that gives us a lot of strength.
I love that. That's one of the reasons that we both like to ask that question so much is it's so easy to think everything about a particular city or state or a part of the country. So it's always great to hear things like that because, maybe not everybody thought that about Ohio, So it's good to kind of expand our minds and hear some of that.
Well, if you're ever in Columbus, a must see is AIMM, although we have a closed door policy. So if you're coming, reach out to me in advance and we'll see what we can do about getting you some exposure to what we do, kind of boots on the ground level. But yeah, it's a great city to come and visit.
Nice. I need to take you up on that one of these days. I assume as you walk in the door, you automatically have a complimentary white coat that you put us in, or do you have to earn that?
No, you have to earn the white coat, Paul.
Okay. All right. I just thought I'd ask. It was worth a try.
Good idea, though.
Yeah, thanks. Well, Nurse Deb, thank you so much for joining us on the show today. It was an absolute pleasure to talk to you, and we can't wait to see you soon.
Thanks so much for having me. If anybody has any questions, don't hesitate to reach out. Happy to help you all however I can.
Thank you. For all of our listeners, please subscribe to Beyond Benefits with Benefits Pro anywhere you get your podcasts. And if you want to rate us, we'd love your feedback. If you have any questions or comments, feel free to email me over at pwilson@benefitspro.com, or you can email Lily at lpeterson@alm.com.
And thank you to our producer, Zach. Join us again next time for a new episode of Beyond Benefits with Benefits Pro. Until then, thanks for listening.